Story 1. 35 chemotherapy treatments, every 3 weeks for 2 years. It felt like being disassembled. The pieces ran over and were then put back together with a handful of bits left over. It was like that for about a week after each treatment. Now in remission and doing okay. Story 2. IUD insertion and pap smear. Felt like they took a toilet brush and shoved it inside me. The IUD insertion was uncomfortable until the little arms on the intrauterine device extended to hold it in place. Felt like I got shot. Story 3. I had sinus surgery some years ago, and to make sure my sinuses did not heal themselves shut, I had to visit an ear, nose, and throat specialist who inserted a sharp object up my nose all the way into my sinus cavity and scraped the scar tissue off the inside of my sinuses. Even with the numbing, it hurt a lot. It took several visits before they were satisfied. Story 4. After my first cesarean section, my uterus was not contracting back to its normal size as it should. The nurses took my husband out of the operating room and told him they would have me out shortly. Four nurses came in and pushed as hard as they could on the area where they had just sewn me closed, while one nurse was internally massaging my uterus. I felt like I was in another dimension and could vaguely hear one of the nurses asking me why I was screaming. I could not talk about the experience for almost a year after my baby was born. The pain was beyond anything I can describe. My husband said that from outside the operating room, it sounded terrifying, and he thought someone had dropped the baby or that something terrible had happened. Story 5. Non-lactational mastitis is rare. When I told my doctor I was in pain, she blamed my period and said I would be fine. A couple of weeks passed, and my breast tripled in size with a fever of 104.8 degrees. The pain was intense. I went to the emergency room and had emergency surgery because I was in septic shock. The wound was so large that they could not close it. For the next 2 weeks, I had to remove the gauze from my wound and repack it every day. It was an awful burning pain. The infection returned, and I had to repeat the process. Thankfully, it is gone now. Story 6. Colposcopy and a loop electrosurgical excision procedure were performed. Colposcopy was done with only ibuprofen for pain. For those who don't know, it is similar to taking a hole puncher to the cervix. The loop electrosurgical excision procedure was performed, but I was not sufficiently medicated. Having an electrified wire pass through my cervix and feeling every bit of it was awful. The doctor did not listen when I requested more lidocaine, similar to dental procedures and getting stitches. Obstetrics and gynecology care is barbaric, and I will not change my mind. Story 7. Unmedicated hysteroscopy. I have had 2 cesarean sections, dengue fever, and cut off a finger. The hysteroscopy was still the worst pain I have ever experienced. Story 8. Most painful was the post-cesarean uterine massage to cause the uterus to contract after birth without labor, with no pain relief. My spinal anesthesia had worn off, and the nurses refused to follow my prescribed pain management plan. Most uncomfortable was having a urinary catheter in place for several days. Story 9. Cervical biopsy. No anesthesia. They are cutting pieces from a very sensitive area. They claim you will only feel some pressure. This is false. What was supposed to take 15 minutes took an hour because they could not get a good angle to collect a sample. Story 10. Being induced is awful. Pessaries are tucked into your cervix, multiple examinations are performed, a balloon is used to manually dilate your cervix, then a knitting needle is used to break the waters, followed by a hormone drip to make you contract. All of this is followed by an emergency cesarean section, from which I had to recover, along with an infection to top it off. Story 11. Uterine biopsy. I have given birth naturally, had teeth pulled, undergone surgeries, endured lacerations requiring dozens of stitches, bruised ribs, broken bones, and nothing compares to the pain of a uterine biopsy. Story 12. Getting my intrauterine device, hands down. I have had cysts on my ovaries, broken bones, gotten tattoos, been in a couple of major car accidents, and so forth. I had never passed out or thrown up from pain until after I had one put in. These women have the audacity to say, "Just take ibuprofen. You're fine to drive yourself home." No, absolutely not. Not only should I have been numbed and possibly sedated, I should not have been allowed to drive. I could barely focus, was in so much pain, and just trying to get back home. I was pretty much bedridden all day with a heating pad. It was awful. Those doctors who lie to you like that should be ashamed, especially when it comes to women's health. My partner had a vasectomy, and his experience was vastly different from mine. He was numbed, given Xanax, and was not allowed to drive himself home. The way women's reproductive health is handled is unacceptable. Story 13. For me, it was an endometrial biopsy. I am not a virgin, but it has been 8 years since I last had sex, so it was very painful, and I bled heavily afterward. The doctor was concerned he damaged the canal due to the speculum and suggested I get a dilator set for more comfort, but I have yet to get one. I do not think I ever will because sex was already painful. That was agony. Story 14. First intrauterine device placement. Never mind the actual pain of the gynecologist clamping my cervix open, apparently because they had me drink a whole bottle of water beforehand to fill my bladder. They wanted to perform an ultrasound afterward to confirm placement. My tilted uterus was even more out of place, and he had to adjust to get it positioned correctly. After dropping the original intrauterine device on the floor, I had to sit and wait with my cervix clamped while his assistant retrieved another one. I almost passed out twice. I experienced severe cramping for 2 days afterward. I had a different doctor from a completely different office this last time. There was no requirement for a full bladder, and the procedure was done in less than 1.5 minutes with minimal pain, only some discomfort. It makes me wonder what the other doctor was doing. Story 15. Radiation therapy. I had to lie flat on my back in a large tunnel. My arms were over my head for an hour every day for a month. Radiation exhausts you. I was on a lot of medication to keep food down. I was much younger than most of the other people in the waiting room. 0 out of 10 experience, but it eliminated my cancer. Story 16. An amniocentesis was performed through the placenta. I have a relatively high pain tolerance and nearly blacked out from the pain. A large needle is inserted through the pregnant abdomen and placenta into the fluid surrounding the baby. Movement is not possible and the area is not numbed. Women's health care is inadequate. Story 17. I have had both a uterine biopsy and a cervical biopsy done at different times without anesthesia. 4 segments were taken each time. I also had a hysterosalpingogram, which involves dye injected into the uterus for an X-ray. These procedures were all uncomfortable and painful. Story 18. I had a cyst growing on the root of a tooth that was pushing into my sinuses. My face felt like it was going to explode. The moment the dentist pulled the tooth, the relief was instant. I have given birth without any pain medication. I have had migraines that lasted weeks. I underwent 5 months of chemotherapy, surgery, and radiation treatment that burned my skin. The cyst growing into my sinuses was the worst pain I have ever experienced. Story 19. I had a hematoma the size of a marshmallow removed from the shaft of my penis, which caused so much pain I still remember it vividly. I had to shower every day and let warm water flow over the open wound, and it felt like pouring lava and glass on it. The pain was worse than anything I have ever experienced. It took 18 months for the skin to grow back fully, and during that time there was no pleasure at all as it would just split the skin and bleed for a long time. Story 20. I had an electromyography a month ago, from waist to toes. I think I would actually wish it on my worst enemy. For those who do not know, it involves needles and electrical shocks, a lot of both at the same time. Edit. And intrauterine device insertion. The only reason this ranked lower is because the intrauterine device insertion took a second, while this took an hour. Story 21. Getting my loop electrosurgical excision procedure sites cauterized without numbing medication because the cervix does not have nerves for pain. Story 22. I had a testicular torsion. I do not recommend it. Firstly, I was a teenager and had never heard of such a condition. I thought it was a case of blue balls because the pain usually went away when I took certain actions. This time, it did not. I managed to fall asleep for a while but woke up feeling like someone was standing on my right testicle. I rushed to the bathroom, tried what I usually did, then took a shower, but nothing helped. I decided to lie on the bathroom floor and moan. which also didn't help but attracted the attention of a parent. They asked about my unusual behavior and quickly took me to the hospital. At this point, I could not put on pants, so I pulled my jeans up to my waist and left them unbuttoned. I had to ride in the car fully reclined to avoid any pressure on the affected testicle. The emergency room sent me to wait for the urologist on call. The doctor was new to the hospital and got lost for a while. By this time, my testicle had twisted enough to cut off blood flow, causing it to swell to the size of a small orange. As time passed, I returned to moaning and hoping for relief. I remember thinking I could not endure the pain much longer. When the urologist finally arrived, he explained the situation and said he would attempt to untwist the testicle temporarily, but surgery would be necessary. He mentioned that the untwisting could be done under anesthesia, but that would make it difficult to tell if he was twisting in the right direction. On the first attempt, he twisted the testicle in the wrong direction, which was painfully obvious. Story 23. Having an abscess on my tonsil led to my tonsillectomy at age 25. The recovery was brutal. Story 24. Bunionectomy. They say it is worse than childbirth, and it was much worse. I have the constitution of a Clydesdale. I could not walk to my car for 8 months. If you have to undergo this procedure, make sure you have adequate pain management, plenty of it. Story 25. The most emotionally difficult and uncomfortable experience has been bladder cancer surgery and treatment. I was anesthetized for the surgery but sent home with a catheter. Imagine going home and spending days with a tube sticking out of your urethra, connected to a bag that needs to be emptied periodically. Not fun. All immunotherapy and chemotherapy treatments are given directly to the bladder by way of a catheter, and I am wide awake. For the men out there, you have not felt real discomfort until you feel a catheter pushed past your prostate. That will make you sit up and take notice. It has been worth it so far, as no more cancer has been detected in 18 months. Story 26. I honestly have medical trauma from all the issues that have occurred. I refuse to see an obstetrician-gynecologist ever again. After my last visit, the radiologist misread an ultrasound report and had me thinking for 3 weeks that I had guaranteed cervical cancer. I was saying goodbye to my children and everything. Once the doctor returned from vacation and performed the procedure wide awake, all 3 males in the room panicked and said they got the measurements wrong. They stopped everything. Nobody consoled me or apologized. It was just all 3 doctors and technicians angry at the radiologist. I did receive a call apologizing for the improper reading, and all bills were written off. The labor and delivery of my son was actually worse and even more traumatic. I won't even type it out. Wish everyone love. Story 27. Table saw injury to my index finger and thumb required emergency room treatment to sew them back together. Numbing didn't work, and I screamed like a little baby. 2 weeks later, I had hand surgery to correct the damage, thankfully under general anesthesia. Both digits were saved, although my index finger is missing a third of the tip and looks more pointed. I have no feeling along the outside of the index finger and the inside tip of the thumb, resulting in lost tactile sensitivity. Holding small objects often causes me to drop them. I can no longer blindly thread a nut onto a screw because I can't feel it. Story 28. I had gum grafting surgery, and they took skin from the roof of my mouth. The recovery was very difficult. Either that or getting a spinal headache after a botched epidural during the birth of my first child, plus a second-degree tear. I had this newborn baby and literally could not raise my head more than 3 inches without experiencing debilitating pain and blacking out. Doctors told me I pulled a muscle in my neck from pushing. It took them 48 hours to figure it out and finally gave me a blood patch since my spinal fluid was leaking. Story 29. I had to get a biopsy on my cervix. They were essentially hole punching my cervix. Nurses had to hold me down. I almost passed out from the pain. Story 30. Getting an ingrown toenail removed sounds mild, but it is very painful due to the many nerve endings in the toes. The stitches went through my nail, which made it look extra bad. The worst part was that it did not improve at all for the first 3 days, and the pain was excruciating, feeling like it would never end. Edit. I am receiving many replies from people who have experienced a similar situation. Best wishes to all of you. Story 31. Being stuck on a dialysis machine for 4 hours every 3 days was very difficult. Not being able to move was challenging. Be careful of the nurses. They are very strict. Story 32. I was having intrathecal chemotherapy when they struck a nerve in my spine with the needle. My leg started spasming violently, causing the most excruciating pain I have ever felt, besides my lung collapsing. Stage 4 cancer at 17 was not fun. Story 33. I had a 9mm kidney stone stuck in my bladder for nearly a year. It had razor-sharp spikes that hooked onto my bladder wall. My urologist had to go in and remove it. They do this by inserting a tool with a camera and grabber up the urethra into the bladder. It took several tries to release it from my bladder wall, and then it slipped out of the grabber halfway through the urethra. Those razor spikes promptly snagged on the walls of my urethra, and the doctor had to go back in and free it to complete the extraction. This whole procedure is done while you are fully awake, and you can watch on the same monitor the doctor is using. I have had many kidney stones, many kidney stents, and several rounds of lithotripsy. They all are unpleasant, but having this large stone forcibly extracted was the worst experience of them all. Story 34. I had to have my last intrauterine device removed from my uterus because it had embedded itself in the wall. They said it was too late for painkillers. They told me, I can't tell if it perforated the wall or not, so if it keeps bleeding, go to the emergency room. Story 35. Hemorrhoidectomy. The procedure itself is fine. Recovery is relatively swift. However, the first 48 hours are extremely painful. An unclean area, an open wound, located over a muscle sphincter, in a place that is designed to give alarm signals if something is wrong. The pain was so severe and sharp that I started fainting when I coughed, moved incorrectly, went to the toilet, or even breathed the wrong way. What makes it worse is realizing that it is actually a minor injury, but it feels like you are dying. It is just a few scrapes and cuts in an unfortunate place, yet suddenly you feel like you are dying. I have also given birth without medication and walked on broken bones. In fact, I combined these experiences when I removed my cast while giving birth. It is absolutely in the same category of severity, if not worse. Story 36. Colposcopy was extremely painful, and I could hardly move for days. It feels like someone is hole punching your insides with no anesthetic or numbing. They told me to take Tylenol beforehand. I have had multiple intrauterine devices and surgeries, and nothing was as painful as the colposcopy. I almost threw up. Story 37. I had an unmedicated colposcopy, which is a cervical biopsy, and an intrauterine device inserted during the same appointment. I was instructed to take 1,000 milligrams of ibuprofen. Story 38. I had a cervical biopsy and 2 intrauterine devices. Both procedures were performed by female doctors and nurse practitioners. I am still astonished that neither of them offered, knew, or fully understood the pain they were causing. Like most, I was simply told to take acetaminophen or ibuprofen before coming in. When I went for my second intrauterine device insertion, I was petrified. I liked how the intrauterine device worked and had to stop oral contraceptives due to rising blood pressure and the continued need for a high dosage of birth control, which increased the risk of blood clots and stroke. I almost passed out from the intrauterine device insertions. When I had my cervical biopsy, my doctor at the time had to take 3 samples. She claimed she missed the first time and didn't get a large enough sample the second time. This provider was forcefully removed from the hospital where I had this done. Story 39. Uterine biopsy. No anesthesia because the medical system is still inadequate in addressing women's reproductive health. Story 40. I had severe dryness in my eye and had to have it scraped clean. Then a patch of new skin cells was applied. They said I should be fine with ibuprofen once the anesthesia wore off. However, I was not fine. I had to pull over and curl into a ball, crying in the back of my minivan until I could force my eye open long enough to call and complain. Story 41. I have been fortunate so far not to have anything major. However, as a teenager, I had a large pimple on my right nostril that would not go away. We went to a dermatologist who used a large needle to give an injection. It brought me to tears since it was right next to my tear ducts. Story 42. Punch biopsy. I have had multiple children. Doctors do not seem to believe that taking pieces of your cervix out might hurt, so they do not bother with any kind of painkiller. The nurse had to hold me down. I am not a sickly person, never been sick, never broken a bone. Only labor, and this was an anticipated pain. The punch biopsy was a total torturous surprise. Story 43. A chest tube is being inserted for a collapsed lung. No medication is given to manage pain or numb the area. The procedure is very painful. Story 44. I got an infection in the pad of my middle finger. When they cleaned it out, they gave me a local anesthetic, then packed it so it would not close up. I went back to get the packing removed, and they did not numb me. I have had multiple natural births, kidney stones, gallstones, bladder stones, appendicitis, and a body full of tattoos. This was by far the single most painful thing I have ever experienced. I lost vision and the ability to speak or vocalize. My brain went dark. There are no words for that level of pain. Story 45. Colposcopy without a shadow of a doubt. 2 of them in quick succession followed by an immediate smear test. That was painful. Story 46. I have vaginismus. My pelvic floor muscles do not work as they should, which makes sex incredibly painful or impossible. Treatment is ongoing, and you need to work at it continuously to avoid relapse. Physical therapy involves someone inserting their fingers into the vagina to manipulate the muscles. It is very painful. On my own time, I have to dilate using dildo-shaped silicone objects to retrain the pelvic floor muscles. This is also often unpleasant. I hate it. I wish I did not have it because I love sex when it does not hurt. Story 47. Colonoscopy. Uncomfortable. Not painful at all, but the preparation you need to go through is a pain in the ass. Basically, you drink about a gallon of liquid laxative that completely cleans out your insides so the camera can be inserted. You are on the toilet for hours. Story 48. I got stung by a jellyfish while snorkeling in Panama, and we were not close to a medical facility. The tour was unprofessional and led by 2 young men who were recommended as trustworthy. While I was swimming, I felt a static sensation run past my right knee, and I immediately went into survival mode, sprint swimming back to the boat. The 2 men quickly rounded up the rest of the snorkelers and sat me down on the boat, which caused the poison from the jellyfish to pool into my groin. This was the worst part. I felt like my leg was either going to fall off or, if it didn't, I wanted someone to cut it off. I was taken to a beach from a location different from where we had started. I was carried off the boat and sat down in the shallows of the beach, where the calm waves reached just below my ribs. By this time, half of my leg had burst out in blisters. I remember the 2 men ran into a beach house that looked like a restaurant bar, and then came back with a short and stout elderly woman carrying 2 gallons of vinegar, a bag of limes, and a machete. They told me it was going to hurt. She cut all the limes in half and ground them into my leg, bursting all my blisters. I was blacking in and out at this point. Once all my blisters were open and raw, they poured 2 gallons of vinegar on the wound. After this, my memory came and went. The elderly woman had me sit in the ocean for 2 hours, feeding me meat, rum, and water to help with the pain. Afterward, I was taken back to my hostel, where I slept for 35 hours. I was fine and decided I didn't need to go to the hospital, which as a more mature adult I don't understand to this day. It was the worst pain I've ever felt, with the worst being the venom in my groin. The end. Story 49. I had an endoscopy without anesthesia because they said it would be quick. I almost threw up at the doctor. Never again. Story 50. Colposcopy. If you ever need one, I am sorry. Do not skip it, but definitely prepare. I have a very high pain tolerance. I thought my appendix rupturing was just a fart I could not pass. They will tell you to take acetaminophen or whatever beforehand. If I am ever in the position to need one again, I am definitely looking for a woman obstetrician gynecologist with a little more empathy. Story 51. Colposcopy, which is the follow-up to an unusual smear result, is not very painful but quite uncomfortable. The nurses, bless them, try to make conversation to distract you while they are examining. Story 52. I suffered from gallbladder pain for almost a year and a half. My husband went to the emergency room for lower abdomen pain and discomfort. He was admitted and had 10 centimeters of his ascending colon removed due to appendix and colon cancer, stage 3C. While he was in recovery, I visited him and had a gallbladder attack. I went to the emergency room since I was already in the hospital. My bile ducts were compounded, and I nearly had my pancreas removed along with my gallbladder. 2 days later, I underwent surgery. The hospital staff kindly kept us in the same room, which they called the honeymoon suite. I was discharged 2 days after my surgery. He was discharged the day after me. I was advised to take a minimum of 3 weeks off to heal, but I needed to return to work because bills were accumulating. I only took 1 week off. After they removed my external drain, I went back to work. While at work, my internal stitches gave way, and I blacked out. I do not remember the week that followed. My husband underwent 7 chemotherapy sessions, which consisted of injections followed by 2 weeks of oral medication, then 1 week off. He was off work for almost a year. He is now in remission, and all of this happened 10 years ago. Story 53. I had a biopsy to get a sample deep inside some tissue. They numbed the area, but the biopsy needle somehow missed the numbed area. Felt like I had been shot. There was much swearing. Story 54. Pap smear or vaginal examination and root canal treatment. They administered all the numbing medication possible, but I still felt every painful moment of the root canal procedures. Vaginal examinations can be very uncomfortable, especially when some tissue is scraped. No medication is typically given for discomfort or pain during vaginal exams. If you want an idea of the pain, imagine scraping your skin with a cheese grater and then applying salt and lemon juice to the wounds. Story 55. Circumcision in my 20s led to swelling that prevented me from urinating, so we had to go to the emergency room and insert a catheter. If you have never had a catheter inserted, you probably cannot imagine what it is like when your penis is full of stitches. I will not elaborate. Story 56. Having my appendix removed was pretty bad. The worst week of my life until I was diagnosed with breast cancer in both breasts. I opted for the mastectomy with reconstruction on both sides. I was supposed to have 2 surgeries. The first to remove the cancer tumors and most of the tissue. They placed tissue expanders and waited. The second surgery was a couple of months later, when they removed the expanders along with any remaining breast tissue and replaced them with proper silicone inserts. Then a few months after that, I had a spot that just wouldn't heal. One day, I developed a high fever and was hallucinating. My husband didn't ask questions. He just put me in the car and took me to the hospital. They ran all kinds of tests, and the only problem area was that spot on my breast that didn't heal. Back under the knife to remove the insert from that side and clean out the infection. Now I'm lopsided. Roughly 5 months later, I was scheduled for surgery to fix my lopsidedness. The surgery went smoothly. Now I'm still lopsided, but not as badly as before. It's been a year and a half since the first surgery. I wish I could say I'm happy with all of it. I am happy to be cancer-free, but I miss my breasts. This with the silicone just doesn't feel right. I'm sure it will normalize over time. It's just right now I'm not feeling it. Story 57. Hysterosonogram. They dilated my cervix, inserted a catheter to inflate a balloon in my uterus, and introduced water. This was done without any numbing, pain relief, or anesthetic. It honestly does not sound as horrible as it felt. I am not usually a crier when it comes to pain, but I was on the verge of sobbing. I have had broken bones, been in car accidents, had road rash, surgeries, and more, but that was by far the worst pain I have ever experienced. I will be giving birth in October. I am terrified. Story 58. Hysteroscopy was much more painful than the uterine biopsy and made my intrauterine device insertion and removal seem like nothing by comparison. I have a considerably high pain tolerance and will never allow either of those procedures again without proper sedation. Story 59. Number 1 would probably be going through debridement after being burned over 22% of my body. Number 2 would be a pericardiocentesis. The doctor missed where he should have been removing fluid from around my heart and stabbed me in my heart. He removed 2 vials of blood from my left ventricle before he realized he was in the wrong spot. All the while, I was awake and telling him to stop, 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 and yelling, "This hurts," while the nurse kept saying, "Calm down. They insert a needle from below your sternum." I asked him if they were going to put me to sleep. "No, it will be over before you know it." Yeah, right. I spent 3 more days in the hospital with a drain tube. He never did apologize. This was a few months after my double bypass surgery. Story 60. It's a toss-up between 1. Medical treatment for an ectopic pregnancy. Over the course of a week, I had 4 large injections in the lower back which caused painful back spasms. A hysterosalpingogram where the doctor did not position the equipment correctly and had to readjust it. There were no pain medications and I passed out on the table. Every part of in vitro fertilization. Egg retrieval put me in the hospital with ovaries so large, each bigger than a grapefruit, that the emergency room doctor said, "What happened here?" The progesterone in oil injections are also very painful. We have run out of injection sites that are not bruised, so my lower back and upper buttocks are a painful mess. On the bright side, I am finally pregnant. Here's hoping it is not a second ectopic pregnancy. For those interested, I started with a needle phobia and began donating platelets to try to overcome it before starting in vitro fertilization. Now, about 9 months into the process, I have had well over 100 injections. I no longer fear needles and highly recommend everyone consider platelet donation. It sounds much scarier than it is, and it is a very worthwhile thing to do. The American Red Cross is wonderful to work with. Story 61. The biopsy of my uterus was very painful but quick. It was the most painful test I had, but I went to lunch afterward and then took a nap. Recovery from egg retrieval, during which 31 eggs were retrieved, was tough for a few days but manageable. Recovery from my first cesarean section was more mentally challenging than physical. I was extra careful, worried about hurting myself. I had been in labor for 66 hours, induced, before the cesarean section, and even that was not too bad physically. Recovery from my second cesarean section was difficult because my baby was in the neonatal intensive care unit 1 hour from home for 2 weeks. I had my tubes tied at the same time as the cesarean section and experienced more pain from that area than from the incision. I had to make that trip every day and walk from the parking lot to the neonatal intensive care unit. That took a toll, but the recovery was fairly quick considering. I weaned myself off pain medication after a few days so I could drive when necessary. Story 62. Electromyography. I have told my children, who are my medical power of attorney if I am incapacitated, that if this procedure is needed, I must either be put into a full medical coma before proceeding or just let me die. Story 63. Needed investigations and treatment for a blocked nerve in the neurological hospital. I cannot remember what the initial procedure was, but what followed I can only describe as some kind of torture ritual. I had 15 blue intramuscular needles inserted fully into my muscles throughout my arm and left in while electrical pulses were passed through my arm. The woman performing the procedure was horrible and did not make eye contact with me once. She gave me no warning or explanation about what she was doing. I told her I could not continue after 20 minutes and the 15th needle had been inserted. She looked at me as if I were something unpleasant and said she was only halfway through the procedure and still had many needles to inject. I told her I could not endure the pain from the needles. She removed them all and told me to leave without looking at me once. I walked out of the hospital and burst into tears. It was really traumatizing. I cannot believe I was not prepared prior to the procedure. 15 years later, I am still shocked by how utterly brutal it was. Story 64. I have had a couple of surgeries, but the most painful was a gum graft to fix a receded gum line. They took a graft from the roof of my mouth and sewed it back on after preparing the site by cutting it up. It hurt worse than my hip surgery, and I was not given any pain medication afterward. Story 65. Ultrasound and magnetic resonance imaging showed breast cancer, so they performed a biopsy of the breast and lymph nodes. They used a topical anesthetic but no local anesthetic for the tissue. The doctor said I wouldn't be able to feel it. I was sobbing in pain with 2 nurses holding me down. One asked if I was crying because I was scared. No, I was crying because I could feel them cutting into my lymph nodes. This was worse than the subsequent chemotherapy, radiation, or the lumpectomy and reconstruction. Second place was back labor. The baby was in the occiput posterior position and chin up, so her head got stuck in my pelvis. I had done labor classes and was expecting intermittent cramp pain during contractions, but this was nothing like that. It felt like someone was taking a giant corkscrew and slowly twisting it into my lower back and pelvis. I couldn't lie down or sit. There was no break between contractions and the pain was sharp. I ended up having a cesarean section. The epidural was the greatest relief. Third place would be emergency vacuum aspiration in the emergency room due to hemorrhaging from a miscarriage. There was no pain management at all. I was lying in a pool of my own blood, which was all over the floor, causing nurses to slip. The doctor inserted a tube into my uterus, and I could feel her suctioning out the contents. I was supposed to stay still, but it was impossible. Shooting spasms went up my back, and my legs twitched uncontrollably. I hope I never experience anything like that again. Fourth is mastitis. Have you ever felt like your breasts are on fire from the inside? I shoved ice packs in my bra in a desperate attempt at relief, but it didn't help. Being a woman is difficult. Story 66. Years ago, a choledocentesis was performed to check for internal bleeding. A large needle was inserted through the vagina into the uterine cavity. Apparently, this procedure is no longer used, and if it is guided by ultrasound. I understand why it is no longer used. Story 67. The nasopharyngeal procedure was quite uncomfortable. Also, I had something in my eye last month. The doctor was using a needle, and I had to remain very still. It was not painful, mostly stressful. Story 68. A hysterosalpingography was performed to diagnose infertility. Double tubal blockage was confirmed. The patient successfully conceived via in vitro fertilization shortly after and had a cesarean section. The hysterosalpingography was still painful. Story 69. I had a severe pilonidal cyst that bothered me on and off for years. The last time it was bigger than an egg, just at the top of my buttock crease, causing constant pain. It was so large that the skin in the area could no longer cover it. It had an opening and constantly oozed. I didn't have insurance at the time, and I had been to many clinics and urgent care centers, but it wasn't helping. They would drain it and it would fill back up, sometimes in just a day. I finally found a place willing to at least cut it open and remove it. What I probably should have had was a full surgery and revision of the skin there, but again, no insurance. I went to the appointment and spoke with the doctor and nurse. They explained the plan. I would be awake, they'd remove as much as possible and sew it back together, hopefully in a better way. Without putting me under anesthesia, they planned to use extra skin and do their best. They left me to get undressed and came back with supplies. They gave me some numbing injections in the area, and then the strangest feeling occurred. My vision went white and I threw up. When I looked at the doctor, blood and pus had splattered up onto his face shield. It seemed the area under my skin was completely full. When he gave the injections, the mass exploded violently. 2 people were covered in my pilonidal cyst fluid. I might be exaggerating slightly. It wasn't as if it was poured over their heads, but it was bad. Because of the tearing, they had to change their plans for closing me up. They did some stitching and packed gauze into the wound. I had to return every day at first, then every other day to have it changed. The goal was to let the wound heal from inside before closing the outside. I want to say I needed the packing gauze for a little over a month. It hurt the entire time, and without going into further unpleasant detail, I had to be very careful with hygiene, especially when using the bathroom. The cyst was located close to a sensitive area, so I was worried about infection, especially with gauze hanging out from under my skin nearby. The good news is this was enough to prevent it from recurring. I guess the pilonidal sinuses were torn apart by the rupture, or maybe the doctor was able to remove them, or perhaps it was a combination of both. Either way, it hasn't bothered me in over 15 years, and I'm glad. I know there are worse situations, and I'm sorry to those who have had truly difficult experiences. This is just my particularly unpleasant medical story. It was a combination of pain and discomfort, especially because it was located on my buttock. Story 70, 3 times. I had a spinal tap when I was 3 or 4. I still remember it, even at that age. I was screaming and moving so much that an adult had to hold down each limb. This is my earliest childhood memory. As an adult, I had a thyroid biopsy a few years ago. They numb the area near the collarbone where the needle goes in. However, the needle is large and they go up your throat to take the samples. The thyroid area cannot be numbed. It hurt a lot when they went in 6 times to get samples. One more experience. After hernia surgery, I was never told that a catheter had been inserted. For 2 or 3 days, I almost cried when I went to the bathroom. Story 71. Kidney transplant, bone marrow biopsy, and infusions for lymphoma. Also, a kidney biopsy where they punctured my lung, causing internal bleeding. I added one more. Story 72. Quadruple bypass. The recovery takes a long time and is extremely painful for the first few months. I had the surgery a year and a half ago and still experienced some discomfort during normal daily activities. They put me back together crooked, so my back issues are worse than before. Story 73. ACL surgery involved wearing a brace from my hip to my ankle, with my leg locked straight. I was in a machine that slowly bent my knee for hours each day. I stopped taking pain medication by day 2 or 3 because it lowered my blood pressure and caused severe constipation. The high school would not have allowed me to attend while on strong pain medication. It has been over 10 years now. I may have retorn the anterior cruciate ligament, but insurance requires me to attend physical therapy before getting an MRI. I gained weight because it hurts to be physically active, and I never learned to run the way the physical therapists wanted me to during rehabilitation after surgery. I cannot stay on my feet for long before it starts hurting, partly due to my weight and partly because my knees are compensating for each other. I miss who I used to be. Story 74. Not painful, but the process of inserting a nasogastric tube is uncomfortable. Take a rubber tube slightly larger than a drinking straw and lubricate it. Then have someone gently insert it up your nose into your sinus cavity, down the back of your throat, through your esophagus, and into your stomach. The person will ask you to keep swallowing the entire time, which goes against your natural instinct. Story 75. 60 rounds of chemotherapy for colon and appendix cancer, plus radiation and 2 total removal surgeries. Diagnosed at 39 with no end sight. I am sitting here after twisted guts surgery yesterday. I would say cancer is the most uncomfortable medical situation I have ever been in. Seems cruel, but I will fight on for another day with my family. Story 76. They did not numb me at all before stitching my torn, swollen areas after giving birth to my baby. I remember begging them to stop and telling my husband to take the baby from me so it would not get stressed by my pain. Story 77. My daughter had leukemia, and the spinal tap was performed to determine if I was compatible for a bone marrow transfusion. I can still hear and feel the needle tip grinding on the bone, 30 years later. They could not use any kind of pain relief or numbing agent, but my mother holding my hand when I was 3 years old to comfort me is a memory I will always cherish. Story 78. Late-term abortion, medically necessary. Induced labor after the baby's heart had already stopped. Left alone in a small room for almost the entire time. Husband was not allowed in, and there were not enough nurses to assist everyone. Minimal pain relief was provided. It was the most painful and horrible experience of my life. I would do it again without hesitation. It was the right decision. Story 79. Eyelid surgery was performed to remove a small nodule. The doctor accidentally hit the nerve while trying to numb the area and began cutting before the area was fully numb. I started screaming, and he told me to be quiet because he would be done soon. The notes stated that the patient tolerated the procedure well. It took 2 years of continuous pain management treatments to alleviate the pain caused by the nerve injury during the injection. I am still terrified when I need to have my eye examined. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.